Mm. Good morning, my name is Octavia Sherrill, and I'm going to show you how to start an IV. First thing first, you need to make sure you get the physician orders. Next thing, you need to get your 2 forms identification. So you're going to ask the patient their name and date of birth, and then you're going to also check the bracelet and make sure that is the correct information. Next, you're going to ask them or confirm, are they allergic to anything that could, like the iodine, the tape, chlorhexidine, any latex. And then you're going to assess the extremities, and you're going to check to make sure they had any trauma that could jeopardize and hurt the IV when inserting it. So if everything checks out okay, they're fine, then you're going to ask the patient, is this the first time you had an IV done? And they say no, that's great. After that, we're going to wash our hands, and we're going to place our tourniquet on 4 to 6 inches above the site, and we're going to place 2 fingers, make sure it's fitting properly, and you're going to check the radial pulse. After that, besides that, the IV that we're going to do an insertion on today is going to be the Doris venous, and then you're going to check that site, make sure there's no hair or anything going on that site, and then we're going to open up our chlorhexidine. And we want to flush this site first and get this prepared. So we're going to draw back a little bit and get some of that water out of there. And I'm going to twist this. Alright, then we'll place this into our bag. Save that for later. Once we're doing that, we're going to put on our gloves, and we're going to clean that area with some chlorhexidine cleanser, and that should dry for 30 seconds. After that side is done and dry, we're going to arch. So we're gonna bring the fingers down so we can visually look at that vein, and it should be 10 to 30 degrees. We have our IV. We're gonna pop that top off, and I'm gonna insert that in. And after we're inserting it, we're gonna check to see if any blood flows through, and it does. So then we're going to place our ring finger on the blue tip, and we're going to bring that blue tip towards the skin a little bit millimeters, and then we're going to take the needle out, pop that yellow tip, and put it into to inject, and put it into the sharps container. Next, we're going to get our chlorhexidine so we can flush the site. So we're going to put that tip on there. Let's screw that tip on. As we're doing that, we're going to hold the site, and we're going to flush 2 to 3 cc's. Alright. And we're going to unscrew that. We're going to place some tape over the side. Before we do that, we got to release our tourniquet. I'm going to place some tape over the side. Strap to my glove. Okay. I'm going to put some tape over the plastic tip, the blue tip, to secure it. And then we have our transparent dressing. So what we'll do with that, we'll place it on top of the blue tip to secure it. Okay. So once we put that on there, I need a new transparent. That I put my transparent dressing on there. It came apart, so it's got stuck to my glove. But that's what you would do. You'll put that. Then you put your name and date of birth. No, you'll put your name, your date, the time on there as well. And then you will go in and you'll put your documentation down. You want to know what the IVs will start at, the patient's medical records. You'll document that, include the date, the time of the IV started, and the gauge that you used, and that's all.